So once you can assume that proper position, the way we actually cultivate that pressure is proper breathing. So proper breathing is what's really necessary for increasing that intra-abdominal pressure. So correct diaphragm breathing, everybody's heard the term diaphragm breathing. I tend to get away from saying the word belly breathing, because belly breathing is actually dysfunctional. If you're only breathing through your belly, that's not what we're looking for. It should be a full expansion of sides, back, and belly all together to really create that pressure. So if I get one of my models, so clinically I can usually have somebody just lay on their back and I can really just see how they're breathing in that setting, but in this setting it's always nice that you can just have somebody sit up as tall as you can, nice and good, without, again, extending into the back. I'm going to take my thumbs, put them right above the hip bones, kind of in the belly. Grab you here, right there, nice and relaxed. He's already braced. So I'm going to take a nice deep breath in for me. Good. He does a great job. And I'm looking for expansion of my thumbs this way and hands outward. I want everything to move together. The second part of that, if I were to go behind him and just feel the lower parts of his rib cage, I should also feel the expansion going to the back as well. My patients, this is actually a nice opportunity to talk about bracing at the same time. So if I have them in that same spot, I'm going to ask them to slowly push their abdominals into my fingers. So he gave me a lot. I'm going to go maybe 20% of that, just a little bit. Good. I want you to hold that tension under my fingers, and I want you to try to give me that big breath again. Good. Don't lose that pressure. As you breathe out, try to keep that pressure there. So that is a perfectly pressurized cylinder right there. Some people are still so ingrained on chest breathing, it's very hard to get them to do diaphragm breathing. A couple cues that I might use is either sniff or sip air. So if I do a really quick sniff, there's really no way I can do that in my chest unless I really, really try to do it. Same thing with sipping. That's really going to activate my diaphragm and get it kind of warmed up for everything else that I'm asking somebody to do. So a lot of times when I'm rehabbing somebody, I'll have them on their back, take a couple sips of air to warm up their diaphragm, and then they can get into their breathing, and it just kind of takes the chest out of the equation.